Hi, my name is Paulina, and today we will be looking at health literacy, and we will also be looking at a training workshop to help providers understand the limited health literacy encountered by patients and how they can address the barriers faced by their patients who have limited health literacy. But first of all, before we get started, let's look at how health literacy is defined. Health literacy is defined as the basic literacy skills for a patient to be able to effectively communicate with their provider and be able to effectively adhere to their treatment and understand their diagnosis. Health literacy is also a communication method for patients to feel comfortable communicating with their provider. If a patient has low health literacy or is limited in health literacy, then they may not feel as comfortable asking questions if they don't feel they understood the information the provider has given to them. By improving health literacy, patients become aware about the general public health issues and improve scientific processes because they become more aware of the public health issues and therefore may become more involved in making decisions that affect them as well. Health literacy also involves having cultural sensitive materials for patients and have them available at any time. And those materials may also be available for health providers so they can understand more about the different cultures and different languages. And health literacy in general, I think, is also seen as a tool to be able to communicate effectively between patient and provider. Unfortunately, more than 80 million Americans have been identified with poor health literacy, and most of the limited health literacy percentages are among the minorities, the elderly, those with a high school degree or less, and those that live below the poverty line or below the national poverty line, so they're low income. And unfortunately, low health literacy can lead to poor health outcomes for various reasons, which we'll be defining shortly. But some of those reasons include readmission into the hospital several times due to inability in understanding their treatment or the prescription, or taking prescription error that may lead to taking the wrong dosage or not taking enough, which can lead to other issues. So the main focus of this presentation are two different key areas of concern, which are patient-friendly health education and addressing language and cultural differences. Basically, for the first item, it's making sure that the materials are available for patients and that they are also easily accessible to take home and be shared with family members who may be able to easily be able to understand the material and relate that to the patient. And then the language and cultural differences relates to translational services and interpreting services, which should be available to patients at any healthcare center. So one of the reasons patient-friendly health education is an issue, is a key area of concern. First of all, more than 50% of Americans are health illiterate, which again can lead to poor health outcomes, meaning poor adherence to treatment, prescription error, limited independence, meaning they have to rely on other family members to help them identify the proper medication that they're supposed to take, and then poor self-management of their healthcare. By addressing patient-friendly health education, we increase a patient's involvement in the decision-making of their health, we improve self-care management, and we also reduce disparities that are related to literacy status. So they're able to stay informed and they're able to make the right decisions related to the health and decrease their likelihood of getting sick again. Friendly health education also addresses language barriers, cultural barriers, and low health literacy, therefore allowing minorities or those who are LEP, limited English proficient patients, to communicate more effectively with providers, which takes us to the language and cultural differences. Again, these are areas of concern, or this specifically is area of concern, due to several reasons. First of all, there's a lack of cultural competent health education out there. There's some health education, but some of it may not be in the language. It may not contain appropriate cultural content where patients may be able to relate more easily. And also, there's incomplete medical history when a patient goes into a hospital, goes sees a provider, and there's no language access, meaning there's no interpreter or translational services, and incomplete medical history can lead to other issues. There may also be a lack of understanding that may be seen as non-compliant, meaning that the provider may think the patient is not wanting to take the medication, when in reality the patient may not understand how they're supposed to take it, or why, or when they're supposed to take it. So addressing the language and cultural barriers provides better healthcare quality to the patients, increases the adverse health outcomes of LEP patients. And then also providers are able to better understand the cultural beliefs around illness and health for those patients, and therefore may be able to incorporate those beliefs into the way in which they give the information associated with their treatment. So there's a lot of benefits in addressing language and cultural differences, and as well as patient-friendly health education. There are several national policies and interventions that have been designed in an effort to improve health literacy among the U.S. population. One of them is a National Action Plan to Improve Health Literacy, which basically engages organizations, policymakers, communities in an effort to improve health literacy. The plan is based on two core principles, and one of them is basically providing the right up to health information, which will allow a patient to make an informed decision about their health. And then also the second core principle is health services delivered in a way that is easily understandable, which will increase quality of life for the patient. And then there are 7 main goals, which are used for strategies by the stakeholders and providers in an effort to improve health literacy. And then the other 2 intervention national policies, one of them is a health literature care model, which guides providers with the idea that they should approach every patient with the assumption of being limited health literacy. That way they don't assume that the patient is able to understand when they do not understand, and then cause other problems. And then there's the Plain Writing Act of 2010, which was signed during the Obama administration along with the Healthcare Act, and it basically requires all federal agencies to use clear communication that is easily understandable by the general public. The plan or the writing, the communication methods must follow the federal plain language guidelines to ensure that all public members are able to understand the material that is provided. So as you can see, there are a lot of efforts that continue to grow in an effort to improve health literacy, which can lead to better health outcomes and for everyone, for patients and for the hospitals. Providers are encouraged to use best practices with patients with limited health literacy. Some of those best practices include no abbreviations, avoid jargon or really long medical terms, which will be really confusing for patients. Providers are also encouraged to use visual and simplified language structures, so anything that is easy for the patient to see, read, and just be able to relate to easily, a visual, a picture, anything that just kind of sticks to their head. Sometimes maybe even having a family member present could also help, because something that the patient may not understand, the family member may be able to understand. And of course, there's the teach back method, which we will discuss shortly as part of our activity. Providers are also encouraged to reflect on the age, the cultural, ethnic, and racial diversity of the patient in an effort to try to approach the situation in a more appropriate method. and making sure that all those things are taken into consideration. And then, of course, the best practices, part of the best practices is to provide language access services, that being an interpreter, a translator, or a sign language interpreter, or some type of visual, if a patient is deaf and can't and needs visual assistance. So we're at the small group exercise stage now, and basically it consists, we will be addressing two key areas that we've discussed earlier, and the purpose of this exercise is to master the teach-back method in person between a patient and a provider, and the audience is the limited English proficient patients, so minorities, or anyone who may have limited health literacy. And the time frame for this activity will be 10 minutes, but each participant will take a role of the provider or the patient and will go back and forth. Some of the tools that will be used is a teach-back model, diagrams that will be used for demonstrating the diagnosis and the treatment. And we will be addressing key areas of concern and how to use the teach-back method to address these two areas and address these two concerns effectively. So as I said, you'll need the teach-back model, visual aids to help you explain the diagnosis. So for instance, type 2 diabetes, maybe provide a diagram that will help you clearly explain what it is and how it affects the body. Diagram of treatment, maybe a calendar or some type of visual aid that shows the patient when they're supposed to take the treatment and how and which pills, so that they themselves can see it visually. So first of all, let's review the teach-back model. This is just a basic diagram of the concept being introduced. So provider giving the information to the patient, and it goes through the cycle of the clinician explaining the process to the patient, the concept, the clinician observing the patient, making sure that they understand, and then asking the patient to demonstrate what had just been told to them, clarifying any questions, and then patient recalls or asks any other questions if there is any ambiguity. And this leads to better adherence of treatment and reduction in error of prescription and treatment. I have a small video here that people should watch as part of the activity to better understand the teach-back method between a provider and a patient. And we're just going to watch a couple seconds of it so you can. Like I said, I'm not going to show the whole thing, but as you can see, she already has a visual aid, and she is sitting directly across the patient, speaking slowly, and making eye contact with the patient to make sure that he's understanding what they're about to talk. So, and she's outlining what it is that they're about to do. So there's just a video, and that's part of the training. Watch the video to learn more about the teach-back method. And here are just the steps of what to do for the teach-back method. So you'll have to divide into two groups and decide who's the provider and who's the patient. Once that's decided, the provider will need to plan how to approach the patient, determine the language, determine racial, ethnicity, anything that you need to assess of the patient to make sure that you provide the information, the appropriate information. The provider will present the diagnosis and treatment to the patient and ask the patient to demonstrate back what they have just been told. And this is going to be a cyclical presentation. The provider will explain, the patient will demonstrate, and if there is any ambiguity or there are any questions, the provider will have to continue to answer the questions, clarify and check, use the show method. So providers, again, ask the patient to show you what it is that's been told. Providers listen and watch what the patient says and watch the body language to make sure that they actually comprehend what it is, and make sure to ask open-ended questions. Yes or no questions can lead to mistakes. So saying, do you understand, can actually, they say yes, and in reality they don't. Patient, make sure to ask questions, have a list of questions ready, request an interpreter if necessary, At the end of the activity, provide constructive feedback on how they can improve their teach-back skills when working with patients. In each review, provide feedback. This is the end of the activity. I hope that you have learned on how to use the teach-back method to improve health literacy outcomes. Thank you.